ngodaba olu-affecta amaphaphu, i-lower respiratory tract infection. Namhlanje sithi ake sikhulume-ke ngodaba olu-affecta ama-tonsillitis, sinusitis kanye nama-adenoids. Njengenjwayelo-ke, angihambi ngedwa, nginodokotela ospecializa ngawo i-ENT specialist, osebenza ngamakhala, ngezindlebe kanye nomphimbo, kanye ne-pharmacist ezosichazela kabanzi ngazo lezi zifo. Ngikwamukele mbukeli lapha ekhaya kuyo ezempilo kuSoweto TV. Ngikwamukele Dr Khumalo and Mr Adries Kubo.
Good morning.
Siyabonga.
Dokotela Khumalo, ake sibuze ukuthi uDr Khumalo ngabe ubani, uqhamuka kuphi kanti futhi usebenza kuphi?
uDr Khumalo uhlala lapha eAlberton, kodwa ke usebenzela eNetcare Park as a ENT specialist. Ngaspecialize ke nge-ENT lapho specialize for 5 years after kade wenze imedicine.
Uspecialize after wenze medicine. Ngicela usithathe nje from matric ukuthi uphase kanjani, wasuyangena ku-MBCHB, wahlala iminyaka emingakanani, mase ihlangene yonke nje ukusibekela isithombe nje ukuthi uhleli isikhathi esingakanani esikolweni.
Okay. Ngisuke eKwaZulu Natal ngiyiza ePretoria eMedunsa ngiyokwenza i-Bachelor of Radiography. Thema ngiqede i-Bachelor of Radiography, so mase ngibona ukuthi kanti nemedicine yenziwa futhi khona la. Ngabe sengiqhubeka sengenza i-medicine. Ngithema ngiqeda ke ukwenza medicine ngabuyela kwaZulu Natal ngiyoseva i-contract yami ngoba ngangithole i-bursary. Ngasebenza eLady Smith naseFryed, ngahlala kakhulu eDandi for 6 years. Ngithema ngiqeda lapho ke ngase ngibuyela ke sengiyospecialize ke ngo-2010. Sengibuyela futhi khona eMedunsa ngiyospecialize ku-ear, nose and throat. Ngase ngiqualify ke ngo-2014 ukuqeda wami ke i-ENT. Thema sengiqedile ke lapho ngasebenza khona futhi ngaba i-specialist for 2 years. Emva kwalokho ngase ngiya ke kwi-private practice. Ngike ngahamba futhi ngaya eMpumalanga ngaba i-head of the ENT eRockfeller Hospital. Thema ngisuka lapho nje base ngila eJohannesburg.
Kusho khona ukuthi noma ngabe usukhule kangakanani, uma ngabe usafuna unesifiso sokuspecialize, you can still go for it. Mr Kubo, as a pharmacist, where do you study to be a pharmacist?
Renaledi University is about 8 in South Africa. They already offer a pharmacy degree, but at the same time, we have the option to study overseas. So this is what I feel like go studies in the country or practice in Goting. This one is be registered with the local council. Because when I'm in South Africa, so to be registered with the South African Council. And the university linting, they know for a pharmacy Goting. University of the Western Cape, ki Goting, go studies in Goting. Honale Happily, University of the North, ki Cheflopo. The University of Witwatersrand, Kiona University of Johannesburg, and then Honale again University of the Northwest, previously in Potchefstroom University, and then Honale University of Port Elizabeth as well, and then Happily Komedunsa, Honale University of Technology, Kwenongor Pharmacy Goting, Igaitio Goting, how interesting who studies pharmacy.
Yeah. As a pharmacist, unobereka fela ko pharmacy ko hospital le di pharmacy tse private or hona le dipleke tse dingwe tse o ka berekang teng holy pharmacist?
Hona le dipleke di le dintsi.
Yeah.
Ke simolotse go study pharmacy le gore ne kwa dilo go study medicine. Mara I really ke fetsa pharmacy kra more advices. Gore what is the scope of a pharmacist? Then ke be ke ba satisfied.
Okay.
I never regretted. I love medicine as well, Mara. The working hours is not for me for medicine. So, just to cut the long story short, pharmacy is very broad. It's not just about dispensing medication or pharmacy or in the hospital. It's very broad. Only manage healthcare, Okaberega as a pharmacist. with a drug utilization review. That's where you review the prescriptions and then you check the combinations of the medication. You monitor the outcome of the patient, and you monitor also the side effects as well. And you can from there communicate with the doctor and the patient. It's important for a high patient require treatment. Treatment must be affordable to the patient in the first place. So you need to understand where the patient is and then discuss with the doctor and decide what really would work for the patient. Cost is very important, and efficacy and safety is very important. That's managed healthcare, and then you'll be working for medical aids. Alternatively, ukabereka in a pharmaceutical industry, that is where I work currently as well, involved in clinical trials. In other words, we create the commercial clinical trials where we run clinical projects to develop medicines that you see on the shelf. But usually they are like global clinical trials. If a trial runs, it runs like everywhere in the world. And there's various regulatory authorities that are approving the clinical trials, and the data also is collected and combined from all the countries to justify the approval of the drug. That's how you get drug on the market. And then you also have the regulatory pharmacist who's responsible for registering the drug through various regulatory authorities. And there's more involvement. I'm not specializing in that, but you do have pharmacists who don't really specialize in that. It can take about 2 years to get a drug registered, but the first step before you get a drug registered or go through the process of registration is a clinical trial. We can run even for 20 years to answer as many scientific questions as possible.
Uyichaze kabanzi i-pharmacy, ngaze nami ngaba nalokhu nje ukuthi ngathi ngaba yi-pharmacist. Ngithanda indlela asho ngayo ukuthi bakhiqiza ama-drugs, okusho ukuthi uyazi ukuthi ku-COVID-19 vaccine bafakeni. Bukele ekhaya, ungasuki, siyabuya, sayophuza itiye.